So we have seen the pre-formulation chapter, and after that we are going to start new chapter. Actually, what is the ideal flow to take this? So initially I should explain you the pre-formulation. After that I should explain you the factors by pharmaceutical consideration of a drug candidate to be considered before the formulation. I have to explain that, but as I have not extracted the content, I will tomorrow extract and I will explain. After that I have to explain you different excipient used in the tablet, and then I should move to the tablets. But वहाँ पे अभी वो कल देखेंगे. So I will explain you tomorrow the biopharmaceutical consideration of a drug candidate that has to be taken into consideration before designing a dosage form. But and after that I will explain you different types of polymers and excipient used in the pharmaceuticals. Okay, and after that I should start tablet. But as there is a lack of time, यहाँ पे थोड़ा सा टाइम का इशू है, इसलिए मैं टैबलेट ले रहा हूँ अभी. लास्ट ईयर यही से स्टार्ट किया था. लास्ट ईयर में एडिशनल जो भी आपका आएगा नेक्स्ट 2 या 3 लेक्चर्स वो सब एडिशनल होंगे. So what is important from your industrial pharmacy? What are the different chapters? So first you can say pre-formulation is very important. After that tablet, capsule, suspension, emulsion, suppositories, aerosols, parenteral products, novel drug delivery system, cosmetics. Okay, these are very important chapters. After that you can expect very few questions from liquid orals and also semi-solids. So that's why we are going to finish all the chapter first and then we'll see me. So today I'm going to explain you tablet chapter. Now tablet will be discussed in the at least 3-4 parts. टैबलेट एक ही लेक्चर में नहीं होगा आपका. टैबलेट के लिए कम से कम 4 या 5 लेक्चर होंगे, मिनिमम 4-5 लेक्चर्स. Every time I used to extract a new content, I used to refer books and then only I used to explain you. टैबलेट में जो ऑलरेडी मेरे पास है तो वो तो आज देखेंगे, कल परसों अपन एक्स्ट्रा का देखेंगे. So first of all, what do you mean by tablet? It is a kind of dosage form. Is a tablet is nothing but the dosage form. What kind of dosage form? It is a solid dosage form. Tablet is a solid dosage form. Solid, whether it is a multi-dose or single dose. Again, it is a unit dosage form. So unit, you take tablet 1, 2, 3. So unit मतलब क्या है? 1, 2, 3, 4 आप ऐसा काउंट कर सकते हो उसको. So tablet is a oral dosage form. Not only oral, nowadays some rectal tablets are also available. Nowadays tablet implants are also available. So a very precise definition of tablet is nothing but it is a kind of solid unit dosage form meant for oral or by parenteral use, containing drug along with the excipient made by compression or molding. Because most of the tablets they are made by compression only, but few tablets are there which are made by molding. Mostly the ancient time, in the when there was a dispensing practices, at that time tablet were made by the process of molding. Nowadays also tablet triturates they are made by molding only. Pills are they are made by molding only. So tablet is nothing but the kind of oral or parenteral unit dosage form containing drug along with the excipient made by compression or molding. So remember, it is a unit dosage form. Different tablets are there, so they are classified in a variety of way. But here I have classified classification of tablets. Now, tablets are classified mostly in a 3 types. So orally used tablet or orally taken tablet or orally ingested tablet. Tablet meant for oral use. So orally ingested tablet. Now in that you have compressed tablet, simply a drug with the excipient made by compression. Then double compressed tablet. Double compressed tablet. So double compressed tablet they are made due to if there is incompatibility between two ingredient, or if you want to make a bilayer tablet, then you have to do double compression. Compressed tablet, simply compressed tablet or double compressed tablet, then delayed release tablet, delayed release. If you want to release a drug for a period extend for a particular time of period, normally what happens, tablet will go in your stomach, it will get disintegrated, dissolution will be there, the drug will be absorbed at a time. But there are certain tablets which releases the drug slowly. They are known as a delayed release tablet. They will release a drug for 1.5 hours, like this. Then chewable tablets. Chewable tablets means these are the tablets which are meant to chew in the tablet. च्यूएबल टेबलेट क्या होता है कि आपको है ना, आपको उसको निगलना नहीं है, आपको उसको मुंह में ही मतलब माउथ में ही रख के उसको उसको ये च्यू करना है. ओके, लाइक अ चॉकलेट. आप चॉकलेट निगलते थोड़ी हो ना, चॉकलेट मुंह में रख के उसका लेते हो, स्वाद लेते हो. राइट. सो च्यूएबल टेबलेट. देन sugar coated tablet is there, then film coated tablet is there, then entry coated tablet is there, entry coated tablet is there, entry coated. Double compressed tablet, delayed release tablet, chewable tablet, sugar coated tablet, and film coated tablet. Now coated means what? Whatever tablet is made by compression, drug with excipient, but uh, due to its uh, bad taste or due to its bad smell, okay, for a for a aesthetic value, now you have to coat that tablet. Either you can coat tablet by using sugar coating. Sugar coated tablet are there. Film coated tablet means, again, main important reason for film coating is nothing but to mask the taste of tablet. So if tablet is very bitter, आप लेंगे नहीं उसको, बहुत कड़वी है तो लेंगे नहीं, तो उसके ऊपर एक फिल्म का कोट रहता है. से फॉर एग्जांपल HPMC, फिल्म कोटिंग पॉलीमर. सो उसका पॉलीमर का एक कोट रहता है. अभी भी टैबलेट कड़वा ही है लेकिन आपको महसूस नहीं होगा. राइट. सो फिल्म कोटेड टैबलेट. sugar coated tablet, again, mostly vitamin preparations they are sugar coated. Vitamins and mineral preparation they are sugar coated. Chewable tablet, if you want to chew in the mouth. Now chewable tablet may offer two type of actions. It may act locally as well as it may act systemically. Right. So to orally used tablet. Now these tablets, these are meant for taken into oral cavity, orally ingested tablet. Second, tablet placed in a oral cavity. tablet placed in a oral cavity. ये निगलना नहीं है आपको, ये सिर्फ रखना है. वहाँ कहाँ पे रखना है? बक्कल, यहाँ पे रखना है, ओरल कैविटी में रखना है. In the mouth you have different cavities. Like in that you are going to have buccal tablet. Buccal means it is a tablet which is placed into the पाउच मेड फ्रॉम चिक्स एंड टीथ. आपका जो टीथ होता है और उसके उसके बाजू में आपका जो चिक होता है, उसके बीच में जो सैक है उसको बोलते हैं बक्कल पाउच. सो यू हैव टू प्लेस दिस टैबलेट in between the space of your teeth and your cheeks. So buccal tablets. Then next is the sublingual tablet. You have to place. That's why tablet placed in the oral cavity. Sublingual tablet. You have to place this tablet below the tongue. You have to place this tablet below the tongue. Below the tongue, you have capillaries. From that capillaries, drug will be absorbed into systemic circulation. So sublingual tablet. Sublingual tablet, right? So yeah, by using sublingual tablet, you can avoid the first precipitate. You have to remember. Then next आता है आपका torches. Torches मतलब क्या है? आपका normal light का torch नहीं. Torches means these are a tablet which are meant to insert into cavities. Now first, mostly it is inserted into tooth cavity. Torches where after the tooth extraction, आपका जो दांत है अगर वो खराब हो गया है, सड़ गया है, उसको निकालते हैं. वो निकालने के बाद में जो बचता है दैट इज एम्प्टी सॉकेट. और उसमें अगर खाना गया तो वहां पे भी है ना सड़ सकता है, वहां पे भी इन्फेक्शन हो सकता है. सो टू अवॉइड दैट, टू ट्रीट दैट, these torches are used. Then okay, dental cones are what? Torches nahi, dental cone. They are the similar thing, but they are the method of manufacturing is different. Torches and dental cone. Okay. Third type of tablet is the tablet for other routes. Tablet for other routes. So rectal tablet is there. Tablet is inserted into rectum for either local effect or for systemic effect. Vaginal tablet mostly for local effect, and mostly they are having antibacterial, antifungal drugs. Rectal tablet mostly, in the vaginal tablet mostly antifungal, antibacterial drugs are there to avoid the infection, to treat the infection. Transdermal tablet, you have to make a small operation. You have to make incision on the skin, and below that you have to place this transdermal tablet. Okay. Implants, same thing. So implants, they release the drug for longer period of time, say for example for few weeks to few months. That's why transdermal implant. So these are the different types of tablet. We'll see one by one. सो आई हैव नॉट इंक्लूडेड हियर पिक्चर्स एंड ऑल दैट। यहाँ पे मैंने कुछ फोटोज वगैरह नहीं लिखे दिखाए, तो फिर टैबलेट का फोटो आपको दिखाना पड़ेगा टैबलेट कैसा होता है, ये तो आपको मालूम होना चाहिए। और टाइप्स ऑफ टैबलेट अगेन यहाँ पे इसलिए मैं फोटो वगैरह कुछ लिखा नहीं, आई वुड हैव शोन, यहाँ पे दिखाया होता लेकिन नहीं। टाइप्स ऑफ टैबलेट, सो फर्स्ट टैबलेट इज टैबलेट फॉर ओरल यूज। ओरल यूज के लिए कितने टैबलेट है? टैबलेट फॉर ओरल यूज, फर्स्ट इज अ सिंपली compressed tablet, is known as simple compressed tablet. Drug along with the excipient, you have to mix in a proper way. You have to make a blend, either dry granules or wet granulation, and that granules they are compressed by a tableting machine known as a simply compressed tablet. Simply compressed tablet, इसमें कोई कोटिंग नहीं है, इसमें कोई फिल्म कोटिंग नहीं है, इसमें मतलब ड्रग अलग विद एक्सपेंट सिंपली कंप्रेशन किया, सिंपली कंप्रेस्ड tablet. मल्टीपल कंप्रेस्ड टैबलेट, मल्टीपल कंप्रेस्ड टैबलेट, एक बार कंप्रेशन किया आपने, दो ड्रग है, से फॉर एग्जांपल इपिडिन हाइड्रोक्लोराइड एंड एमोक्से, ओके, इपिडिन हाइड्रोक्लोराइड एंड फिनिलेप्रिन हाइड्रोक्लोराइड, ये आपको दोनों ड्रग का कॉम्बिनेशन यूज करना है इसमें सर्दी में, ठीक है। इपिडिन हाइड्रोक्लोराइड एंड दैट फिनिलेप्रिन दे आर इनकॉम्पेटिबल टू ईच अदर, तो आपको क्या करना है, व्हाट यू डू, यू हैव टू compress इपिडिन, ephedrine hydrochloride, you have to make a small tablet, okay, half compression, that is known as half compression. So make a ephedrine hydrochloride half compression. After that you have to make another compression, compressed tablet of your phenylephrine, and then finally compress both two, so to avoid the incompatibilities of drugs, okay. So multiple compressed tablet, mostly they are used, they are done by, they are produced due to incompatibilities, to avoid the incompatibility within two material, they are separately compressed, and then finally they are compressed. So bilayer tablet, mostly bilayer tablet, और इसमें और भी एक आता है मल्टीपल कॉम्प्रेस टैबलेट, मल्टीपल कॉम्प्रेस टैबलेट, से फॉर एग्जांपल तीन है, अगर इफ देयर आर थ्री ingredients which are incompatible with each other, first you have to make pre-compression of one, then pre-compression of second, third, and then final compression of three. So multiple compressed tablet, layer tablet or bilayer tablet or multi-layer tablet, layer tablet, bilayer tablet, bilayer मतलब बाय मतलब दो, लेयर मतलब दो, लेयर मतलब क्या, bilayer tablet और multi-layer tablet. So multi-layer tablet, okay, so tablet within a tablet within a tablet, tablet within a tablet within a tablet. देखो क्या बोलता है यहाँ पे, बोलता है एक बड़ा बड़ा सा टैबलेट है, उसमें क्या है और एक टैबलेट है, उसमें भी क्या है और एक टैबलेट है, टैबलेट within a tablet within a tablet, there are three tablets, so multi-layer tablet, tablet within a tablet, okay, tablet within a tablet is a bilayer tablet, tablet within a tablet means tri-layer tablet. Now compression on pre-compressed core material, जो भी core material होगा, मेन जो भी core material है, और एक मटेरियल कॉम्प्रेस करो, उसके ऊपर और एक मटेरियल कॉम्प्रेस करो, दैट इज नोन एज अ tablet within a tablet within a tablet. So compression on pre-compressed tablet or pre-compressed core material, core initial, it is more preferred than compression coating. Mostly tablet for local effect in the GIT, tablet for local effect in the GIT. For example आपको डायरिया है, फिर आपको दूसरा कोई, आपको ड्रग GIT में चाहिए, you need a drug in a GIT. So initially in the first transit one layer will be dissolved, in the second transit second layer will be dissolved, in third transit third layer will be dissolved, so it can retain in the GIT and it can exert the effect for longer period of time, multi-layer compress. Now there are three principles for making of this multiple compress tablet. So compression coating is one method, Colton model is another method, Stokes model is there, and mesentery terracotta model is. So principal design of compression coating. Compression coating के लिए तीन मेथड, there are three models. Three principal design of compression coating. Colton model is there, Stokes model is there, and mesentery terracotta model is there. मशीन के नाम है. Now delayed release tablet, delay हो रहा है. नॉर्मली टैबलेट लेने के बाद में 20 मिनट्स में टैबलेट आपका ब्रेक होना चाहिए एंड उसने ड्रग रिलीज करना चाहिए. डिले रिलीज मतलब क्या, अगर वो 20 मिनट के बाद भी ड्रग रिलीज नहीं कर रहा है, वो 30 मिनट 45 60 1 hour 2 hour के बाद में रिलीज कर रहे हैं. That is known as a delayed release tablet. Delayed release means to bypass the stomach and release drug into intestine. Delayed release. If drug is incompatible with the acid, if drug is broken down into acid, so that tablet is coated with the some polymer, and that polymer is not soluble in the acid but in the basic environment. जब intestine में जाएगा तो वो रिलीज करेगा. Delayed release tablet, और इसको एंट्री कोटेड भी बोलते हैं. डिलेड रिलीज मतलब वो जल्दी रिलीज नहीं होगा. सस्टेन्ड रिलीज टैबलेट, सस्टेन्ड रिलीज एंड एंट्री कोटेड. डिलेड रिलीज, डिलेड रिलीज, सस्टेन्ड रिलीज, एंट्री कोटेड tablets. So sustained release to get a action for longer time, to get a effect for longer time. That is a sustained release tablet. A tablet is coated, okay, tablet is coated with such kind of polymers that they will not release drug quickly, they will release drug slowly for longer period of time. तो जैसे है ना आपका सेलुलोज डेरिवेटिव वगैरह, so they are used. Entry coated tablet means what? Entry coated tablet is done to prevent the irritation in the stomach or if drug is being destroyed in the acid environment. Why we used to do entry coating? इसके ऊपर रीजन के ऊपर क्वेश्चन आता है. एंट्री कोटिंग टैबलेट क्यों करते हैं? व्हाट डू मीन बाय एंट्री कोटेड टैबलेट? सो एंट्री कोटेड मतलब क्या? सपोज दिस वन इज योर स्टमक इंटेस्टाइन. सो एंट्री कोटिंग मींस वो टैबलेट है ना स्टमक में नहीं पैक होना चाहिए. सो दैट टैबलेट शुड नॉट रिलीज द ड्रग इनटू स्टमक इन एसिड एनवायरनमेंट. नाउ व्हाई? बिकॉज इफ ड्रग इज इरिटेंट टू योर जीआईटी, अगर ड्रग स्टमक में रिलीज होगा है वो इरिटेशन करता है. सो you prevent release of drug from stomach and release that drug in the intestine either, or if drug is being destroyed because of the gastric juice. अगर आपका कोई एंजाइम ड्रग है, कोई हार्मोनल ड्रग है, या फिर कोई आपका एंजाइम ड्रग है, हार्मोनल ड्रग है, ईस्टर है कोई, that will be hydrolyzed in the acid. So you have to make entry coated tablet. So you have to prevent the loss of drug. Okay, so that entry coated tablet will not broken down into in stomach. They are entry coated tablet, they are coated with the entry coating polymer, also known as a pH dependent polymer, you know. So entry coating polymer, they will not release the drug in the stomach, they will release the drug in the intestine, okay, where there is a basic environment. क्योंकि आपके स्टमक में क्या है? योर स्टमक एज एसिडिक एनवायरनमेंट. स्टमक में होता है आपका एसिडिक एनवायरनमेंट. व्हाट इज द पीएच ऑफ स्टमक? 1 to 3. 1 से लेके 3 तक पीएच आता है. और इन द इंटेस्टाइन व्हाट इज द पीएच? 7 to 9. 7 to 9 pH. So in the intestine you have basic pH, in the stomach you have acidic pH, right? So entry coated tablet means the tablet is not released, tablet will not release drug in a stomach, it will release the drug in the intestine when there is a basic environment, right? Reason क्या है? Because drug is returned to your stomach or drug is being destroyed in the acid environment. Are you getting or not? समझ रहा है आपको? Okay, that is the main reason for entry coating, right? Sugar coated tablet, sugar coated tablet, sugar का coating है tablet के ऊपर, sugar का layer है tablet के ऊपर, है ना? Sugar coated tablets. Several sugar coats on tablet, several sugar coats on tablet to increase the 50% weight. So उसको बाद में भी आएगा sugar coating process. But remember in the sugar coated tablet, so डबलिंग ऑफ वेट इज पॉसिबल. जो शुगर कोटेड टैबलेट होता है उसमें डबल भी हो सकता है वेट, बिकॉज उसके ऊपर आपको सेवरल लेयर्स ऑफ शुगर आपको ये करना है. यू हैव टू कोट सेवरल लेयर्स ऑफ शुगर ऑन अ टैबलेट, कोर टैबलेट. दैट्स व्हाई इंक्रीज इन द वेट इज देयर. सो यू कैन से up to 50 to 100% weight can be increased after sugar coating of tablet, or you can say doubling of weight is possible in the sugar coating of tablet. Now you may find mostly the multivitamin preparation. जो मल्टीविटामिन है ना, मल्टीविटामिन प्रिपरेशन जो होते हैं, मोस्टली मल्टीविटामिन प्रिपरेशंस दे आर शुगर कोटेड, दे आर शुगर कोटेड. शुगर कोटेड टैबलेट मल्टीविटामिन का ही मोस्टली होता है. देयर इज वन आई थिंक एक ये है, एक टैबलेट है दैट इज चॉकलेट कोटेड. एक्चुअली इट इज अ मल्टीविटामिन टैबलेट, चॉकलेट कोटेड मल्टीविटामिन टैबलेट. अभी याद नहीं आ रहा है उसका नाम. और फिल्म कोटेड टैबलेट. Film coating is done due to bad taste of your drug. Film coating of tablet. So plasticizer or plasticizer is used to make a film coating for masking of taste. That is the effective method of coating. Film coating is mostly done to mask the taste. अगर ड्रग है बहुत ही बिटर है, बहुत ही कड़वा टेस्ट कर रहा है, तो स्मेल भी कर रहा है, so they you have to make a film, a thin film over a tablet which will not affect the therapeutic effect of tablet. वो बाद में एक बार एसिड में गया तो रिलीज होता है वो. That's why film coated tablet. Film coating is done by using cellulose derivative. Most commonly used film coating agent is nothing but the HPMC. HPMC आता है most commonly used film coating. इसके ऊपर GPAT 2020 में क्वेश्चन गया है. HPMC, hydroxypropyl methyl cellulose, HPMC, most commonly used film coating polymer. Then chewable tablets. Chewable tablets इसके ऊपर भी क्वेश्चन आता है. Now these are tablets which are intended to chew in the mouth, not to swallow. Example, aspirin tablet. The chewable tablet are mostly formulated for antacid tablet. Antacid का जो tablet होता है, for example, there is one tablet in the market, Gelosil MPS. Gelosil MPS is the tablet which is a antacid tablet. Gelosil MPS is a tablet which is known as a antacid tablet, which is a chewable tablet. Which chewable tablet? First pass bit can be bypassed to quite some extent, but not fully. But sublingual tablet में fully होता है. Now एक क्वेश्चन आ चुका है दो तीन बार, which diluent is most commonly used or which sweetener is most commonly used in the chewable tablet. याद रखना है आपको. Mannitol. Mannitol is the most commonly used sweetener in the chewable tablet. Now, what is the reason why mannitol is used as a sweetening agent commonly in the chewable tablet? Mannitol is a commonly used sweetener in the chewable tablet because remember, mannitol has a negative heat of solution. Mannitol has a negative heat of solution. उसका negative heat of solution है ना. मतलब क्या, जब वो सोलिड डिजोल्व होगा, डिजोल्व कहाँ पे होगा, यहाँ पे वाटर थोड़ी है, आपके माउथ में जो सलाइवा है उसमें डिजोल्व होगा. So whenever mannitol will dissolve in your saliva, what will it do? Okay, as there is a negative heat of solution for mannitol, so it will produce cooling effect. It will produce a cooling effect in the mouth. It will produce a cooling effect in the mouth, right? So it gives sweet taste and cooling effect. That is the reason why mannitol is most commonly used as a sweetener in the chewable tablet. ठीक है. इसके ऊपर दो बार क्वेश्चन आए. शुगर कोटेड टेबलेट की ये जो है इज मोस्टली फॉर मल्टीविटामिन प्रिपरेशन. इसके ऊपर एक और क्वेश्चन है. डबलिंग ऑफ वेट इज पॉसिबल इन द शुगर कोटेड टेबलेट. आपको बाद में भी देखेंगे. प्लास्टिसाइजर यूज्ड इन द फिल्म कोटिंग टेबलेट. फिल्म कोटिंग टेबलेट में कौन सा मोस्ट कॉमनली यूज्ड प्लास्टिसाइजर? इज HPMC. एंट्री कोटिंग में एंट्री कोटिंग पॉलीमर यूज करते हैं. आपको बाद में देखेंगे. ये जस्ट इंट्रोडक्शन. Now tablet used in the oral cavity. Tablet used in the oral cavity. So first is nothing but the buccal tablet. Buccal tablets, they are held between teeth and cheeks. That is cheek pouch. Whatever space is there between teeth and cheeks on the cheek pouch. So you have to place the tablet and hold the tablet in the pouch. Buccal tablet. Nowadays it is outdated. Sublingual tablet, very important. Sublingual tablet. Now these tablets, they are held or placed below the tongue. You have to place tablet below the tongue. It is mostly a vasodilator type of drug used in the angina. तो angina pectoris में vasodilator type जो drug होता है, mostly isosorbide dinitrate. Isosorbide dinitrate. That is given by sublingual route. Then mostly anti-emetic drug. एंटी इमेटिक जो वोमिटिंग होता है आपको, तो उसमें भी ये दिया जाता है बाय सप्लिमिनली. सो मोस्टली vasodilator type of drug used in the angina pectoris. Then few drug known as a anti-emetic drug like chlorpromazine, prochlorperazine, like that. These kind of drugs, they are also given by subliminal route. Subliminal route, so whatever that is being absorbed below the stomach, that is directly going to the systemic circulation. So first pass effect is avoided. Designed to disintegrate and dissolve slowly. Such kind of tablets, they are designed to disintegrate and dissolve slowly. Now lozenges or lozenges and torches. लोजेंजेस इसके ऊपर भी क्वेश्चन आया कप ड्रॉप रिसेंटली आ चुका है लोजेंजेस मींस व्हाट कप ड्रॉप सो यू माइट हैव सीन विक्स की गोली लो खींच खींच दूर करो विक्स की गोली लो खींच खींच दूर करो विक्स क्या होता है इट इज अ कप ड्रॉप सो इट इज अ लोजेंस इट इज लोजेंजेस अगेन देयर इज वन मोर आपने देखा होगा टीवी पे एडवर्टाइजमेंट कि आजकल नए नए डॉक्टर एडवर्टाइज करते रहते हैं स्टेपसिल्स कफ so all they are known as lozenges. They are intended to exert their local effect in the mouth, usually for coughing and sore throat. अगर आपका गला खराब है गले में खिचखिच है तो स्टेप सेल्स लेते हैं उसमें क्या है कि उसमें एंटीबैक्टीरियल ड्रग होता है एंटीबैक्टीरियल एजेंट होता है डिसइंफेक्टेंट होता है सो chlorhexidine etc. So such kind of dosage form is known as the lozenges. So lozenges or cup drops they are intended to exert their effect locally in the mouth. Usually they are meant for the treatment of cough or sore throat. Now lozenges again they are compressed. They are made by either compression or molding. ये compression और molding में होता है. Lozenges are prepared by compression or molding whereas the trouches they are mostly prepared by molding. Trouches होते हैं वो molding से बनते हैं and lozenges they are prepared by either compression or molding. वही difference होता है trouches और lozenges में. Now dental cones they are designed to place into the socket, empty socket remaining after the tooth extraction. आपका दांत निकल लिया दांत जिसमें फिट होता है वो सॉकेट होता है you know the empty socket so after the extraction of tooth there may be a development of infection there might be development of right so that's why to prevent the bacterial growth antibacterial drug containing dental cones are available. Now next is the tablet administered by other route. Other route से कौन से में so tablet inserted in the body cavities like vaginal tablets and tablet implants. Rectal tablet is also there. So rectal tablets sometimes they are classified under suppository chapter. So vaginal okay vaginal tablets are ovoid or pear shaped tablets. They are used to retain in the vaginal cavity. Mostly they have antibacterial drugs, antifungal drugs, okay, antibacterial drugs, antifungal drugs. pH is important consideration. pH is important consideration for these tablets because the pH of these tablets should match with the pH of vaginal fluid. That is around 4.5. 4.5. Because otherwise, what happens if there is a no pH is there? If no pH is present, so what happens? There is irritation in the cavity. Okay. The next one is a okay tablet for implant should be cylindrical or rosette shaped and should be not more than 8 mm of okay, not more than 8 mm in the size is the length. इम्प्लांट टैबलेट जो होता है वो एक तो रोजर शेप का होना चाहिए या फिर सिलेंड्रिकल शेप का होना चाहिए एंड नॉट मोर देन 8 mm इन साइज तो उसके लिए एक इंजेक्टर भी होता है कर्न इंजेक्टर इज यूज्ड टू इंजेक्ट द इम्प्लांट implant are replaced by now replaced by controlled silicone tube filled with the drug or biodegradable polymer. Now what is now implants are replaced by this new technique. Definition okay definition controlled silicone tube. मतलब क्या definition controlled silicone tube मतलब क्या कि बाहर से आप कंट्रोल कर सकते हो उसका रिलीज by using a magnet and or something by using a program etc. Right? So they are the again implant. They are the duration of action is implant के लिए duration of action कितना होता है? They are longer acting, long acting few months to year. Are you getting or not? समझ रहे हैं आपको? Now tablet used to prepare the solution. इसके ऊपर भी क्वेश्चन आ चुके हैं recently. जो DI का एग्जाम हुआ था उसमें एक क्वेश्चन आया था. Now first is effervescent tablet. Effervescent tablet. What do you mean by effervescent? Now these are designed to dissolve with the release of carbon dioxide. So effervescent tablet जो होता है वो टैबलेट जब मिक्स करते हो आप वाटर में there is a release of carbon dioxide because these tablets are made from mixture of citric acid, tartaric acid and sodium bicarbonate. Now these tablets will have These contain mixture of citric acid, tartaric acid and sodium bicarbonate. Now what happens citric acid, tartaric acid, sodium bicarbonate? They will when they will come in contact with water, they will react, they will release the carbon dioxide. Now whatever carbon dioxide is released, now that carbon dioxide will mask the taste of that. Now taste masking is done due to that carbon dioxide. Effervescent tablet. They produces clear solution, pleasant flavor, mostly formulated for systemic antacid. Effervescent tablet. जैसे आपका इनो जो है इनो इट इज नॉट effervescent tablet but it is definitely effervescent granules. इनो जो है ना effervescent granules का एग्जांपल. सोडा जी. Now next one is the dispensing tablet. Dispensing tablet are made to dissolve in a specific volume of water and contains water soluble component. Dispensing tablet का होता है tablet made for making a solution. Dispensing tablet. Hypodermic tablet. मोस्टली इसके ऊपर बहुत कंफ्यूजन होता है. दिस इज नॉट टैबलेट इंसर्टेड इनटू द स्किन. हाइपोडर्मिक टैबलेट मतलब इसका मतलब ये नहीं कि इंसर्ट करना है स्किन के नीचे. हाइपोडर्मिक टैबलेट इज टैबलेट व्हिच इज डिसॉल्व इन अ स्टेराइल वाटर फॉर इंजेक्शन immediately after preparation of solution. Again, dispensing tablet, these are the tablets which are meant to prepare a solution in a specific volume of water. Hypodermic tablet, these are a tablet meant to make a solution in a sterile water for injection. Solution for injection. याद रखना. Hypodermic tablet. इसके ऊपर क्वेश्चन आता है. Now what is it is no more used. Tablet triturate. They are molded tablet. ये molding से बनता है. Molded tablet using alcohol as solvent. Not used nowadays. Tablet triturates. Molding मतलब क्या आपका उसका ये रहता है साचा. Next is the various excipient used in the tablet manufacturing. जो भी ड्रग है आपका ड्रग along with the excipient because suppose that your dose of drug is a 2 milligram. अगर आपके ड्रग का डोज है 2 milligram, so you cannot formulate the tablet of 2 milligram. So you have to formulate at least 10-15 milligram tablet. Now for that you need a excipient. You have to add bulking agent, you have to add dilute, you have to add binding agent for granulation, you have to add disintegration agent for disintegration, you have to add a glidant to improve the flow of like the lubricants coloring agent. So these are known as a excipient used in the tablet. Okay? Excipient used in the tablet. तो excipient बहुत सारे टाइप के होते हैं. तो पहला क्या है फर्स्ट फिलर और डाइल्यूएंट. फिलर्स और डाइल्यूएंट. So what is the role of filler or diluent? Diluent का role क्या होता है? What is the role of diluent in the tablet? To increase the bulkiness of tablet. ये role important है. Role पूछते हैं. They used to ask you role. What is the role of diluent? What is the role of disintegration? What is the role of glidant? Last year भी question आया है. I will explain you. What is the role of your diluent? Role of diluent is nothing but the to increase the bulk, to increase the bulk of tablet. Role of binders to increase the bulkiness in the tablet. जैसे मैंने बोला है if your dose of drug is a 1 milligram or 2 milligram, you want to make a tablet of 10 milligram. So how it's possible? It is possible because of the diluent or bulking agent or fillers. Okay, example क्या है इसका? Example of diluent lactose USP, anhydrous lactose, spray dried lactose, directly compressible starches, hydrolyzed starches, microcrystalline cellulose, diabasic calcium phosphate, mannitol sorbitol, calcium sulfate dihydrate, dextrose. ये सब क्या है? All these are known as a tablet diluent. Now what is dextrose? Anybody? What is dextrose? क्या होता है dextrose क्या होता है? Yes, anybody? What do you mean by dextrose? आपको समझना भी चाहिए. Yes, anybody? Can can anybody tell me what do you mean by dextrose? Dextrose क्या होता है? किससे पूछ लें? Dextrose is nothing but the it is a D-glucose. Dextro dextrorotatory glucose. Dextrose is nothing but the dextrorotatory glucose. So you might have seen the saline solution. In that you are having dextrose normal saline. Dextrose क्या होता है? Dextrose मतलब D-glucose. क्योंकि ग्लूकोज जो है ना डेक्स्ट्रोरोटरी होता है. फ्रुक्टोज इज नोन एज अ लिवोरोटरी. दैट्स व्हाई फ्रुक्टोज इज अ लिवो. दैट्स व्हाई फ्रुक्टोज इज नोन एज अ लिवेलोज. इसके ऊपर भी एक बार क्वेश्चन है. फ्रुक्टोज इज नोन एज अ लिवेलोज. डेक्स्ट्रोज is nothing but the D-glucose. कैल्शियम सल्फेट क्या है? इनऑर्गेनिक डाइल्यूएंट है. डायबेसिक कैल्शियम फॉस्फेट इनऑर्गेनिक. मैंटोल, सल्फेटॉल, starches, these are the diluent. Now next is a binder, binding agent, binder or binding agent. It is the used for the, it is used to adhere, to increase the adhesiveness during the granulation of tablet. So what are the binding agents? Binding agents are nothing but the acacia, cellulose, gelatin, glucose, polyvinyl pyrrolidone, starch, pre-gelatinized starch, sodium, sodium arginate, sorbitol, trigon. They are nothing but the binding agent. Am I audible to you? Am I audible? Bind. Remember the role of diluent. Remember the role of binding agent. Next is the disintegrating agent or simply disintegrants. What is the role? To break down the tablet. Okay, to break down the tablet complete. To break down the tablet. Okay, so if you make a tablet, if you made compression, made tablet, and if that tablet is not broken down in the stomach, then what is the use? Tablet बना लिया आपने, है ना? tablet market में आ गया, वो tablet पेशेंट ने लिया, tablet ब्रेक ही नहीं हो रहा है स्टमक में, ड्रग रिलीज नहीं हो रहा है, तो उसका उपयोग क्या है? कोई फायदा नहीं, फेंक के देना पड़ेगा उसको, right? So disintegrants, these are the agent which helps to break down, to disintegrate the tablet in the stomach. Now, what are the example of disintegrants? Starch, cellulose, arginate, polyvinyl pyrrolidone, cos-carbamylose. These are the example of disintegrating agent. Now, glidant means what? इसके ऊपर क्वेश्चन आ चुका है. So, glidant is nothing but the, what is the role? To improve the flow of granules from the hopper to the die cavity. Glidant will decrease the contact angle, and it can improve the flow properties. So glidant example याद रखना है, उसका role याद रखना है. What is the role? Role is nothing but the, to improve the flow. Example is nothing but the silica derivative like colloidal silicon dioxide, talc, and cornstarch. They are the diluent. Now, what do you mean by anti-adherent? Anti-adherent exactly work opposite to the binder. Anti-adherent means will prevent the adherence of particle. It will prevent the adherence of particle. Example is a magnesium stearate, starch and talc. Magnesium stearate, starch और talc क्या है? Anti-adherent. Now इसके ऊपर क्वेश्चन आता है GPAT 2023 में. पहले इसके ऊपर ऑलरेडी आ चुके हैं क्वेश्चन, ऐसा मतलब नहीं कि इसके ऊपर आया नहीं, आ चुके क्वेश्चन. Lubricants. What is the role of lubricants in the table? To reduce the friction of machine and its component. To reduce the friction of machine and its component. That is the role of lubricant. To reduce the friction of machine and its component. The role of lubricant. So example क्या है इसका? Stearic acid derivative, then polyethylene glycol, surfactants and waxes. They are the lubricants. Oil भी यूज करते हैं. Coloring and flavoring agent. तो food, drug and cosmetic. FDC. Food, drug and cosmetic. Then drug and cosmetic dyes and lakes. They are used. Spray and other flavors, natural and artificial sweeteners. They are also used in the tableting process. है ना? कि आपको टैबलेट देखो ना, आप टैबलेट अगर अच्छा मस्त ग्रीन कलर का टैबलेट है तो आपको अच्छा खाने में मजा आएगा. अगर ब्लैक कलर का टैबलेट आपको खाने में मजा थोड़ी आएगा. देख देखिए आप, तो वैसे मजे के लिए थोड़ी खाते टैबलेट, लेकिन फ्लेवर अच्छा आता है तो पेशेंट कंप्लायंस बढ़ता है. तो दिस स्वीटनिंग एजेंट, फ्लेवरिंग एजेंट, कलरेंट्स, what will they be? What will they do? They will increase the patient compliance. We are going to see everything. AFDC dyes वगैरह सब देखने वाले हैं. Some multiple use excipient in the tablet. कुछ multiple use excipient है. So example first one is ethyl cellulose. So ethyl cellulose derivative. So it is used in a 1 to 3% as a binding agent. Ethyl cellulose binding agent as a 1 to 3% used for wet or dry granulation. Now again in the same concentration it can be used as a controlled release coating. Ethyl cellulose कैन बी यूज्ड फॉर कंट्रोल रिलीज कोटिंग। सेलुलोज में देखो बहुत सारे डेरिवेटिव, मिथाइल सेलुलोज, इथाइल सेलुलोज, प्रोपाइल सेलुलोज, हाइड्रोक्सी मिथाइल सेलुलोज, हाइड्रोक्सी प्रोपाइल सेलुलोज, HPMCP, हाइड्रोक्सी मिथाइल प्रोपाइल सेलुलोज, है ना, सोडियम कार्बोक्सी मिथाइल सेलुलोज, लॉट ऑफ डेरिवेटिव्स आते हैं। आउट ऑफ ऑल दिस डेरिवेटिव एक क्वेश्चन आ चुका है, which cellulose is a water insoluble। ठीक है, क्वेश्चन क्या है, वाटर सोल्यूबल कौन सा है। तो रिमेंबर, याद रखना है, सेलुलोज, इथाइल सेलुलोज इज अ वाटर insoluble, is a water insoluble, इथाइल सेलुलोज इज अ वाटर insoluble। बाकी मिथाइल सेलुलोज, प्रोपाइल सेलुलोज, कार्बोक्सी मिथाइल सेलुलोज, माइक्रोक्रिस्टलाइन सेलुलोज, हाइड्रोक्सी प्रोपाइल मिथाइल सेलुलोज, all they are the water soluble, okay? But ethyl cellulose is not a water soluble polymer, okay? Now second is a glyceryl palmitostearate. Glyceryl palmitostearate, it is a ester of glyceryl with palmitic acid. What is the role? In a 0.1 to 5%, 0.2, 0.1 to 5%, it is used as a lubricating agent। 10 to 50 concentration में आता है। It is used for control release excipient, it's a control release excipient। Okay. Hydroxymethyl propyl cellulose, HPMC, HPMC. So in a 2 to 5% concentration, it is used as a wet or dry binder. In 2 to 10% concentration, it is a film former. Again, 5 to 25%, it is used as a control release excipient. Control release excipient. Okay. Magnesium aluminum silicate. Magnesium aluminum silicate. तो 2 to 10% में इसका यूज होता है बाइंडर, 10% अगर डिसइंटीग्रेट, बाइंडर एंड डिसइंटीग्रेट। माइक्रोक्रिस्टलाइन सेलुलोज, इट्स अ माइक्रोक्रिस्टलाइन सेलुलोज इज वेरी वेरी इंपॉर्टेंट पॉलीमर है माइक्रोक्रिस्टलाइन सेलुलोज। इट्स ट्रेड नेम इज एवीसेल, इसका ट्रेड नेम होता है एवीसेल। ये और भी मैं बाकी सभी इसका ट्रेड नेम का अलग कर लूंगा, एवीसेल, इट इज नोन एज एवीसेल। इसके ऊपर क्वेश्चन आया जीपैट 2021 में। माइक्रोस्टाइन सेलुलोज नॉट इविसेल, बाकी और भी जो भी है ना उसका है, बुक में मिला है मुझे, लेखन की बुक में, पूरे डिफरेंट डिफरेंट ये पूरे डिफरेंट डिफरेंट डाइल्यूएंट्स एंड देयर ट्रेड नेम मेरे बुक में भी है, लेकिन एडिशनल और भी मिला है। माइक्रोस्टाइन सेलुलोज इन a 0 to 8%, it is used as a it to improve the adhesion of film core. 0.2 to 0.5%, it is a glidant. 5 to 20%, it is anti-adherent. 5 to 20% disintegrant, and again 5 to 25% binder and filler. So it is a multi-purpose dilute, okay, multi-purpose tablet excipient, multi-purpose tablet excipient कौन सा है आपका, माइक्रोस्लाइन सेलुलोज। Are you getting my voice properly? Are you getting my voice or not? We'll see the next point. Next is the polyethylene glycol. Polyethylene glycol. Polyethylene glycol. Next क्या है, polyethylene glycol. Now what is the main role of polyethylene glycol? So polyethylene glycol in a 0 to 10% will act as a lubricant. Then 0 to 15% thermoplastic filler, or it is called as a binder. 5 to 40% में is a control release excipient. Control release excipient. Polymethyl acrylate. Polymethyl acrylate. तो जो acrylate होता है रेजिन होता है, it is a resin. So it is a entry coating polymer, याद रखना है, entry coating polymer. Entry coating. Now 2 to 10% polymethyl acrylate is used as a film former. 20 to 5 to 20% control drug release excipient. 10 to 50% filler. In a concentration of 5 to 10%, it is used as a coating excipient. Polyvinyl pyrrolidone. Polyvinyl pyrrolidone also known as a povidone. Povidone उसको बोलते हैं, PVP. So in 5 to 15% concentration, it is a weight binder. 5 to 10% coating excipient है ये, 5 to 10% coating excipient ऐसे यूज करते हैं। 5 to 30% concentration में इसका disintegrant P बोल के यूज करते हैं। 10 to 30% control release excipient. Now starch. Starch is also multi-purpose. It's also multi-purpose. Tablet dilute, multi-purpose है। In 13 to 3 to 15%, it is used as a binder and disintegrant. 5 to 25% used as a weight binder, and again 5 to 20% disintegrant. तो ये बाइंडिंग एजेंट भी है, डिसइंटीग्रेंट भी है, फिलर भी है ना, सब है। starch, microcrystalline cellulose starch. They are the multi-purpose tablet diluent. Commonly used weight binders and granulating agent. बाइंडर कब करते हैं? आप पाउडर, अगर आपके पास सिर्फ पाउडर है उसका ही टैबलेट बनाने जाओगे आप, तो टैबलेट बनेगा नहीं, बन भी गया तो बाद में टैबलेट फूटेगा. Now what you have to do, you have to convert that powder into granules, and then if you compress that granules, so granules will have some type, some percentage of moisture, say for example less than 2%, but that moisture will hold material together, tablet will not broken down easily. So commonly used binders in the granulating binders and granulating agent. Gum acacia mucilage 1 to 5%. Now क्या करता है ये? It produces very hard and friable granules. Cellulose derivatives microcrystalline cellulose हो गए 5 to 10%. HPMC is most commonly used. Ethanol भी granulating agent है. Applied to easily hydratable material. Gelatin okay, gelatin syrup or gelatin solid 10 to 20%. Gels in cold strong adhesive used in the lozenges. तो gelatin जो है ना cold condition में जेल होता है उसका. It is a very strong adhesive agent used in the lozenges. Glucose syrup 20 to 30% strong adhesive and tablet may soften in a high humidity. टैबलेट में सॉफ्टन है. ग्लूकोज सिरप अगर यूज करेंगे तो जो टैबलेट है वो softening भी हो सकता है उसका in high humidity condition. Next is nothing but the starch mucilage. Next is nothing but the povidone. Povidone 5 to 15%. Different grades will give different type of granules. Starch mucilage 5 to 10% again. Paste binding agent. Starch mucilage. Sucrose syrup 65 to 95% strong adhesive tablet में soften IMT हो चुका है. Tragacanth mucilage 10 to 20% produces very hard friable granules applied to easily hydrated material. तो ये binding agents है आपके tablet में. Super disintegrant very important part होता है super disintegrant. Super disintegrant भी इसको मैं लिखता हूँ very important. Very important. Lot of times they already ask question on this. Super disintegrant. A tablet immediately आपको release करना है. If you want to release the tablet within a seconds, if you want to dissolve a tablet within a, if you want to break down a tablet within a fraction of second, so you have to use super disintegrant. Now super disintegrant they will help to break the tablet within a very small time. Now super disintegrant they are nothing but they are used to they are used to promote the disintegration of tablet. Very important. So super disintegrant के नाम आपको याद ही होना चाहिए. उसका मैकेनिज्म है, उसका नेचर दिया है और कमेंट दिया है. फर्स्ट वन इज क्रॉस कार्मेलोस सोडियम. क्रॉस लिंक्ड सेलुलोज डेरिवेटिव है. क्या है ये? देखो नाम में रखा है, आप बोलते हो नाम में क्या रखा है? क्रॉस मतलब क्या? क्रॉस लिंक्ड. लोज येलो इज लोज मतलब क्या? सेलुलोज. So it is a cross-linked cellulose derivative. Cross-linked cellulose derivative. उसके ही डेरिवेटिव है और भी से एक्डीसोल प्राइमिलोज देन सोलूटैब. क्रॉस कार्मेलोज सोडियम एक्डीसोल प्राइमिलोज सोलूटैब सब क्या है? क्रॉस लिंक्ड सेलुलोज डेरिवेटिव. और मैकेनिज्म क्या है? हाउ इट विल डिसइंटीग्रेट अ टैबलेट. सपोज आपने क्रॉस कार्मेलोज सोडियम टैबलेट में डाल दिया रिक्वायर्ड अमाउंट में और टैबलेट बना लिया ड्रग डाइल्यूएंट क्रॉस कार्मेलोज सोडियम. जब वो टैबलेट वाटर के कांटेक्ट में आता है, वाटर कहाँ से आएगा? वाटर इज प्रेजेंट इन योर जीआईडी. सो व्हेन a tablet will come in a contact with your GID fluid, when tablet will come in contact with the gastric juice, so as soon as जैसे tablet gastric juice में या फिर किसी के contact में आता है water में, the tablet will swell 4 to 8 times in a less than 10 सेकंड. जैसे ही वाटर कांटेक्ट में आएगा ये इतना स्वेलिंग हो जाएगा, बस्ट हो जाएगा टैबलेट. इमीडिएटली वाटर के कांटेक्ट में आता है, स्वेलिंग होकर बस्ट होता है. बस्ट हो गया मतलब ड्रग रिलीज हो गया. क्रॉस कार्मेलोज सोडियम इज अ सुपर डिसइंटीग्रेंट. इट विल रिलीज अ drug within a 10 second. It will release drug within a 10 second. So bidirectional swelling is there. Ecdisol primaloz solutab Swelling and wacking is the mechanism for drug release. So out of that, acadisol is a directly compressible dilute, and primulose and soludap they are the starch free. इसमें starch नहीं होता. Now next is a cross povidone. Cross povidone. Cross मतलब क्या? Cross link आएगा. Povidone मतलब क्या? Polyvinyl pyrrolidone. Cross linked polyvinyl pyrrolidone. Again, it will swell little, but it will release drug mostly due to capillary action. Capillary वाटर के कांटेक्ट में आएगा, swelling इसका कम होगा, लेकिन जब कांटेक्ट में आएगा ये कैपिलरी प्रोड्यूस करता है उसमें टैबलेट में और ड्रग रिलीज करता है. इंपॉर्टेंट है. वाटर इनसोल्युबल एंड स्पॉन्जी नेचर. ये क्या है? प्रोस्पोइडोन जो है जो वाटर इनसोल्युबल होता है, वाटर इनसोल्युबल स्पॉन्जी इन नेचर. टू गेट अ पोरस टैबलेट इट विल प्रोड्यूस अ पोरस टैबलेट. Are you getting or not? समझ रहे हैं आपको? Are you getting or not? Important है. सुपर डिसइंटीग्रेंट बहुत बार क्वेश्चन आ चुका है इसके ऊपर. सुपर डिसइंटीग्रेंट. अगेन नेक्स्ट वन इज नथिंग बट द कॉलिडोन. कॉलिडोन इज आल्सो. कॉलिडोन क्या है? क्रॉस पोइडोन का ही भाई है ना. क्रॉस पोइडोन क्रॉस लिंक्ड पॉलीविनाइल पाइडोन. एंड कॉलिडोन क्या है? इसका ही ब्रदर है, उसका ट्रेड नेम कॉलिडोन. सेम थिंग. नेक्स्ट होता है आपका सोडियम स्टार्च ग्लाइकोलेट. सोडियम स्टार्च ग्लाइकोलेट इसका ट्रेड नेम होता है एक्सपोर्ट ऐप प्राइमोजेल. प्राइमोजेल एक्सपोर्ट ऐप. दे आर नथिंग बट द सोडियम स्टार्च ग्लाइकोलेट. तो एक्सपोर्ट ऐप किसने बोला? व्हाट इज द एक्सपोर्ट ऐप? व्हाट इज द नेचर ऑफ एक्सपोर्ट ऐप? सोडियम स्टार्च ग्लाइकोलेट. व्हाट इज द नेचर ऑफ प्राइमोजेल? क्या है? सोडियम स्टार्च ग्लाइकोलेट. सो इन दिस क्रॉस लिंक्ड स्टार्च आर द cross linked starch. Now, when this tablet containing sodium starch glycolate or export or primogel, when come in contact with the gastric juice, it will swell. It will swell 7 to 8 times in a less than 30 seconds. Swelling हो गया मतलब bursting होता है बाद में. So it will release a drug in 30 seconds. Swells in a 3 dimension and serves as a matrix for sustained release. Now next is the thing of the alginic acid. Alginic acid भी क्या है? Super disintegrant. Cross linked alginic acid. Rapid swelling in an aqueous medium. Tablet containing alginic acid will swell rapidly when come in contact with the gastric juice. बाद में it is used for both dry as well as wet granulation for the promotion of disintegration. नेक्स्ट आता है सोया पॉलीसेकेराइड. सोया पॉलीसेकेराइड क्या है? सोया है मतलब नेचुरल सुपर डिसइंटीग्रेंट. नेचुरल सुपर डिसइंटीग्रेंट क्वेश्चन आ चुका है इसके ऊपर. नेचुरल सुपर डिसइंटीग्रेंट डज नॉट कंटेन एनी स्टार्च. नेक्स्ट होता है आपका कैल्शियम ट्राइसिलिकेट. कैल्शियम सिलिकेट. सो अगेन वीकनिंग एक्शन, वीकनिंग ऑफ टेबलेट. ऑप्टिमम कॉन्सेंट्रेशन इज 20 to 40%. इट विल प्रोड्यूस हाईली पोरस टेबलेट. तो देखो इसके ऊपर क्वेश्चन कैसे कैसे आ चुके हैं. जो क्वेश्चन आ चुके हैं उसका मैं बोलता हूँ आपको कहाँ कहाँ से क्वेश्चन है. आपका क्वेश्चन ऐसा आएगा. फॉलोइंग इज इनऑर्गेनिक सुपर डिसइंटीग्रेंट. इनऑर्गेनिक सुपर डिसइंटीग्रेंट कौन है? इनऑर्गेनिक कैल्शियम सिलिकेट. देन सोलूटैप इज अ ट्रेड नेम ऑफ क्रॉस कार्मेलोस. ठीक है, ऐसा क्वेश्चन होता है. Ecdisol cross carmelose, primulose cross carmelose, sodium cross carmelose, or simply cross linked cellulose derivative. सब ecdisol, primulose, solutap ये क्या है? क्रॉस लिंक्ड सेलुलोज. क्रॉस लिंक्ड सेलुलोज, क्रॉस कार्मेलोज ये सब क्या है? सुपर डिसइंटीग्रेंट. क्रॉस पोइडोन, क्रॉस लिंक्ड पॉलीविनाइल परलोन. कॉरिडोन भी क्या है? सेम थिंग. सोडियम स्टार्च ग्लाइकोलेट के ऊपर क्वेश्चन आ चुका है. क्रॉस कार्मेलोज के ऊपर क्वेश्चन आ चुका है. इसके ऊपर पूछा है. इंपॉर्टेंट मैकेनिज्म भी पूछा है. स्वेलिंग मैकेनिज्म है वो भी पूछा है. नेचुरल सुपर डिसइंटीग्रेट सोया पॉलीसेकेराइड. इनऑर्गेनिक कौन सा है? कैल्शियम सिलिकेट. कैल्शियम सिलिकेट. तो इम्पॉर्टेंट है. मला दुसऱ्या विंडोमध्ये यायला लागेल. नेक्स्ट इज नथिंग बट द ग्रॅन्युलेशन टेक्निक. नेक्स्ट वन इज नथिंग बट द ग्रॅन्युलेशन टेक्निक. ग्रॅन्युलेशन, देर आर डिफरेंट ग्रॅन्युलेशन टेक्निक. So dry granulation is there, wet granulation is there, direct compression is there, and all-in-one granulation method is there. And dry granulation मतलब क्या? Simply drug, required amount of drug plus dilute plus बाइंडिंग एजेंट प्लस डिसइंटर्ड प्लस जो भी आपका एस्थेटिक के लिए फ्लेवर कलर. So you have to finally make a blend. Okay, blend, and you have to pass through a roller mill. You are going to get a sludges. Now you have to break down that sludges into smaller tablets, smaller granules. Pass through sieve, you are going to get granules. That is a dry granulation. In that also there are two types. Wet granulation मतलब you are using solvent over here, binding agent over here. Direct compression means some diluent are directly compressible, so direct compression. So first one is a dry granulation. So final powder mixture or blend is placed between roller compactor or specially designed tableting machine. मैंने बोला है कि ड्राई ग्रेनुलेशन देयर आर टू टाइप. ड्राई ग्रेनुलेशन के लिए फाइनल ब्लेंड जो है आपका, फाइनल मिक्सचर जो है आपका, so whatever final mixture is there, you have to pass through roller mill. Once you pass through roller mill, you are going to get small, okay, you are going to get large size flakes. ना फ्लेक्स बने बघा तुम्ही. आपण रोलर मिल मधनं काही पावडर किंवा माती पास केली, तुमच्याकडे काही असे मोठे मोठे ढेपा भेटले, ढेपा मातीमध्ये त्याला ढेप म्हणतात, ढेप. So you are going to get large size flakes. Now that flakes you have to broke down in a planetary mixer, and you are going to get small size granules. There is one method. Another method is that by using your final blend, final जो mixer आहे, you can make a large size tablet by using a specially designed tableting machine. मोटे मोटे tableting machine असतात. Normal tablet तो छोटे असते, but normal tablet छोटा होता है, but ये जो large size tablet making machine है, इसमें आपको finally जो blend होता है, you have to pass through that machine. You have to make large size tablet, and then you have to break down that tablet into small granules. Small granules, right? A final powder mixture is placed between roller mill or specially designed tableting machine having dies and large capacity. Powder is pressed between flat tablet or pellet to form a sludge. Now, whatever large size tablet you are going to get, or whatever sludge you are going to get, that is known as sludge. A mass, it is the mass is formed is known as sludge. Now, sludge. Now, you have to break down this sludge into smaller granules, which are subsequently passed through milling and screening. The process is also known as sludging and desludging. The sludging desludging that occurs in the dry granulation. Question एक बार आ चुका है. Sludging desludging occurs in the dry granulation. Sludging means what? So making of large sized tablet or flake, large sized flakes or tablet from a dry mixture known as a sludge. Making is known as a sludging. The breakdown of that large sized tablet, sludge or flakes is known as a desludging. So sludging, desludging, that process they occurs in the dry granulation. इसके ऊपर भी क्वेश्चन आ चुका है. There is one machine known as chalconator. There is one machine known as a chalconator roller compact is used in the large scale dry granulation. दिखाता हूँ मैं आपको. Dry granulation, dry granulation. It can be made. Okay. So first dry mixing. So जो भी material है आपका blend, shifting, mixing and final blending. Then such sludge desludge, मतलब making of large size tablet, sludge and desludge, milling, sizing and final blending, compaction, finally compression. You can see over here. So for example, whatever blend is there, आपका जो final blend ready है, mixture of drug along with the excipient as per the formula. Now you have to pass this blend through a roller compactor. Roller compactor or double roller, triple roller mill. You can see roller compactor. You have to pass this powder through roller. Now you are going to get, after passing, you are going to get compacts or flakes. Now these flakes you have to broken down into small granules. Milling means that planetary mixer or incising. You are going to get granules over. That is the one way. Second way is that same final blend is passed into specially designed tableting machine. मेथड दैट इज स्लजिंग. सो ए ब्लेंड से आपको लार्ज साइज टैबलेट बनना है, टैबलेट कॉम्प्रेशन मशीन में. वी आर गोइंग टू गेट स्लज. स्लज मीन्स लार्ज साइज टैबलेट. और these sludge tablets you have to break down using planetary mixer, planetary mixer, and then you have to pass through sieves. You are going to get small size granules. That is known as a sludging desludging. This sludging desludging क्या होता है? Making of large size tablet, final mixture. Making of a large size tablet of final mixture. Making of a large size tablet of final mixture is known as a sludging, and breaking of this tablet to smaller granules known as a desludging. तो क्वेश्चन आता है sludging desludging occurs in the which type of granulation? Sludging desludging occurs in the dry granulation. Sludging desludging occurs in the dry granulation. So dry granulation. Yeah. So chinsonator roller compactor is used in a large scale dry granulation. दूसरा आता है wet granulation. Wet granulation means you have to use here binding agent, solution of binding agent or solvent. On the laboratory scale, आप कैसे करते हो कि you are mixing that binding agent, you are making a starch paste, है ना, and you are making a dump mass of that powder. You are passing through screen. You are going to get granules on laboratory scale. On the large scale, rapid mixer granulator. Okay, then Disono mixer granulator, topo granulator, fluidized bed granulator, fluidized bed granulator. इसमें तीन मेथड आता है, रोस्टर टेक्निक आता है, देन रिलेटिव टेक्निक आता है, बहुत सारा सी एफ ग्रेनुलेटर, डायनोटा मिक्सर, ये सब इंस्ट्रूमेंट होते हैं इन द वेट ग्रेनुलेशन. देन डायरेक्ट कंप्रेशन, सम पाउडर्स दे आर डायरेक्टली कंप्रेसिबल, फॉर एग्जांपल सोडियम क्लोराइड, पोटेशियम क्लोराइड, सोडियम ब्रोमाइड. तो ये जो मटेरियल है डायरेक्टली कंप्रेसिबल, all in one the granulator method, all in one granulation method. This is a continuous fluid bed processing using the fluid bed granulator. Fluidized bed dry होता है उससे ही granule बनते हैं FBD. Now in the FBD there are three methods: top spray, top spray, दूसरा होता है bottom spray. Bottom spray is known as a roster technique. Bottom spray is known as a roster technique because Dale E. Roster he has developed this technique. Roster technique. Question आता है इसके ऊपर. Tangential spray is known as a glat air technique. Last year में यह है glat air technique. I will explain you. Either you can use aqueous solvent or you can use non-aqueous solvent. Non-aqueous में mostly ethanol use करते हैं. Shifting, mixing, granulation, drying, milling and sizing, final blending. Shifting, mixing, sludge, desludge, milling, sizing and